In this video, we listened to the chair of POTS UK and retired GP, Dr Leslie Cavey, talk with Dr Boon Lim about why some GPs have limited knowledge or awareness of POTS, how to get the most out of your appointment, and advice on what tests to ask for in order to support your first appointment with your consultant.
Why do GPs know so little about POTS, and what can you do to advise patients to get over some of the challenges they face with meeting a GP who says, I don't know anything about POTS?
So I think one of the first issues is that it was relatively recently recognised and named and defined. And so it hasn't really fully got into the curriculums at medical schools or, for example, on GP training schemes. It is there sometimes now, but it tends to be a little bit haphazard in the way that this is approached. In terms of what they can do, we have a leaflet on our website, and it's for GPs. It's been designed to be brief because GPs are much more likely to read something that's concise in their consulting room. So it's called POTS on a Page. It's under downloadable leaflets on POTS UK website. So I think either taking that to your consultation, or depending on the system that your practice uses, you can either email it in, or if you're in a conversation with the GP using their text messaging system, you can text it across to them as well. And that will give them a sort of brief overview of what POTS is. In terms of when you're actually consulting with your GP, it's always good to plan ahead, and it can be useful to try and summarise your symptoms and what the problems are as concisely as possible, and to put things in a list from the most important to the lesser important, and be prepared to go back, because the GPs only have 10 minutes per patient, generally speaking. And so sometimes it's necessary to try and deal with the different aspects of your problems in more than one consultation.
So, Leslie, you're a patient. You now are fairly convinced you have POTS because you've read a bit on the POTS UK website. And so you're not in a position where you're doubting the diagnosis. It's fairly clear. How best can you help your GP with the first consultation to make it go as smoothly as possible?
Well, once again, going in armed with the leaflet can be helpful. Maybe ask the GP what their understanding of POTS is, so that you kind of know what you're dealing with when you go in. And also just taking some blood pressure and heart rate recordings from home can be useful. If you're particularly symptomatic, then take them when you're very symptomatic and record what your symptoms are and what your posture was at the time. And some people manage to do a home stand test, a 10-minute stand test, and we will be having information in this series of videos about how to do that. And I think taking that into your GP consultation can be very powerful.
That's exactly right. And I would also strongly advocate, if a patient has a blood pressure machine, one day, or the patient should be looking at the active stand test template that they can download on the POTS website. And that will get you off to a head start when you see your GP.
So, Boon, when the patients are consulting with their GPs, is there anything they can discuss with their GPs regarding information that can be given to you to help you with the first consultation that you have in the hospital setting?
So that's a really good point. If you're speaking to your GP, the most helpful information I can have as a secondary care consultant would be to have an ECG. So I ask your GP to do an ECG and a series of blood tests, which includes a full blood count, a thyroid function. I would like to see a vitamin D level as well. And of course, it would be nice if a GP could forward me your active stand test results, which typically you can do at home and pass on to the GP as a leaflet. So there's a section here in the POTS series that will guide you how to do an active stand. If you can bring that for the GP and they can forward it together with all the other information. It's incredibly helpful and will get us off to a head start when you come and see us in secondary care.
Thank you. So that's really helpful to know.
In summary, remember to take the POTS UK GP POTS on a page document to your appointment. If you are able to send this in advance, it can be helpful. As appointment times are short, be realistic about what you hope to achieve and be prepared. Make a written list of your symptoms and perhaps rank them in terms of severity. Be prepared to go back. Sometimes one appointment isn't long enough. Ask your GP what their understanding is to see what point you are starting from. Remember, GPs are human too, and being kind and courteous despite your frustrations is always advisable to get the most out of your appointment. Take some blood pressure and heart rate recordings from home, making a note of what your posture and symptoms were at the time of recording. In order to support your appointment with a consultant, ask your GP to request an ECG, series of blood tests including full blood count, thyroid and vitamin D levels, and to forward your active stand results onto your consultant.